An Introduction to Disabilities. In this module, you will learn about categories of disabilities, some communication, social, and behavior challenges that a student with a disability might have, strategies to address those challenges, and lastly, some general tips to keep students with disabilities safe. Let's get started. A disability can be broadly defined as an impairment that substantially affects a person's life activities. Individuals with disabilities may have cognitive, language, social, emotional, or physical delays as compared to their peers. The Individuals with Disabilities Education Act, or IDEA, is a federal law that requires schools to serve the educational needs of eligible students with disabilities. The IDEA has identified 13 categories of disability. They are autism, deafness, deaf-blindness, hearing impairment, multiple disabilities, orthopedic impairment, other health impairment, serious emotional disturbance, specific learning disability, speech or language impairment, traumatic brain injury, visual impairment, including blindness and intellectual disability. Students with disabilities between the ages of 3 to 21 years may be eligible for special education services. These students may require specific accommodations or adaptations for their educational, communication, behavior, or socialization needs. Now we'll take a look at challenges that some students with disabilities may have and strategies to address those challenges. Let's start with communication challenges. Some students with disabilities may have difficulty with communication. These communication challenges can range from mild to severe and can affect the way students process and use language. Some challenges include difficulty understanding verbal communication, such as verbal questions and instructions. Difficulty understanding nonverbal communication, such as gestures or body language. Difficulty in processing language, which may lead to a delay in responding to others. And difficulty communicating one's thoughts, needs, and feelings. Here are a few strategies for communicating with students who have difficulty with communication. Get the student's attention before speaking, for example, by calling the student's name or by using a gesture. Face the student directly when speaking. Speak in clear and concise sentences and avoid using abstract language. For example, instead of saying, "Wouldn't it be nice if everyone remembers to be considerate and clear your table of any trash?" say, "Please put your trash in the garbage." State what you would like the student to do. For example, instead of saying, "Don't stand up," say, "Please sit down." Don't speak too quickly and give the student time to respond. Some students may communicate in different ways. For example, they may use a communication device or use sign language. Remember that just because a student is not using spoken language, it does not mean that the student cannot understand what you are saying or does not want to communicate. Always use respectful language and create opportunities for the students to interact with you. Next, let's discuss social interaction challenges. These challenges may include difficulty with social gestures and facial expressions. For example, a student may find it extremely difficult to maintain eye contact. Difficulty understanding another person's thoughts and feelings. For example, the student may be unaware of or misinterpret social and emotional cues like tone of voice and body language. Difficulty with social use of language. For example, the student may use unusual or repetitive language, may have difficulty understanding jokes or sarcasm, and may have difficulty taking turns in a conversation. Some students may also have sensory issues that make it difficult to tolerate physical, visual, and auditory input and contact from others. For example, the student may feel overwhelmed by a noisy environment or from physical touch. Here are some strategies for interacting with students who have difficulty with social interaction. Be positive. Remember not to take it personally if the student engages in seemingly odd or inappropriate behavior. For example, a student who has difficulty maintaining eye contact may not look at you when speaking. He or she is not trying to show disrespect or lack of interest. Similarly, be patient and do not take it personally if the student says something inappropriate. The student may be completely unaware that what he or she said could be offensive to others. Try to find a common topic of interest with the student and engage in conversation about that topic. For example, you can ask the student what his or her favorite food is. Finding a shared interest can help you better connect with the student. Be observant of any outward signs that the student may be feeling uncomfortable or distressed. For example, a student may be sensitive to loud sounds, and you may need to speak to him or her at a lower volume. Now we'll take a look at behavior challenges that some students with disabilities may have. Some common challenging behaviors include non-compliance, running or wandering off, self-harm or self-injury, destroying property, aggression like hitting or kicking, and tantrums that may involve behaviors such as crying, screaming, and throwing oneself to the ground. When it comes to challenging behaviors, prevention is key. Here are some strategies that can help prevent challenging behaviors from occurring. First, make sure that rules are clear and consistent. Review the rules with students and post them in a highly visible location. Whenever possible, provide students with choices. For example, where to sit or who to sit with, or what activity they would like to do. Look out for and acknowledge appropriate behaviors. For example, you can give a student behavior-specific praise, such as, "Good job, John. I love how you sat down quietly and kept your hands to yourself." Once a challenging behavior has occurred, it is important that you avoid power struggles and always try to stay calm. If there is conflict between students, try to separate them from each other if possible. You might not be able to resolve conflicts right away, especially if the student is upset. If possible, allow the student to take a break. Do not hesitate to seek help. For example, the student's parents or teachers will often have good advice on how to avoid known triggers to the challenging behavior and how to de-escalate the behavior once it has occurred. Now let's end with a few general tips to help promote the safety of individuals with disabilities and those around them. If a student is agitated, remove any items within the student's vicinity that might be dangerous or that the student might break or throw. Always try to protect the student and those around him or her from harm. Report any bullying incidents or suspected incidents immediately to the principal. And when there is a medical emergency, check for medical bracelets and call 911. This concludes our module on An Introduction to Disabilities.